I think the thing we've missed in medicine for many years regarding these chronic infections is that these are chronic biofilm infections. So whether you're talking about otitis media or chronic sinusitis or chronic prostatitis or candida in the gut or salmonella or endocarditis, these are all chronic biofilm infections. And, we learned it in med school, but nobody really taught us coming out, which biofilm agents do you use? How long do you use it? How do you treat it differently? This is where one of, I think, the gaps in medicine exists in, the chronic infectious world. But I feel like once we get this randomized double-blind placebo-controlled trial for Dapsone done, I think it's going to wake people up. And I think a lot more people will be using this protocol, including young doctors and even the older ones. But they do need to be trained in Dapsone because the side effects of the drugs, which I call do no harm, H is Herxheimer reactions, because there's a lot of inflammation when you're killing the bugs. A is anemia. It's a folic acid-induced anemia. You got to give massive doses of folic acid. And now I even use some methyl B12 and iron just to make sure all the pathways are being covered. R are rashes. Fortunately, even people who are sulfur sensitive, like Bactrim sensitive, they can take it. Sometimes I need an H1H2 blocker, but I don't usually see rashes. The worst side effect that I used to see and no longer see was methemoglobin levels in the blood that went up. And that's a side effect of Dapsone from oxidative stress, where you don't carry oxygen well. Well, in the last protocol that I published 3 months ago in Microorganisms, we upped the methylene blue dose to 300 milligrams twice a day. That ended up lowering down the methemoglobin levels to an average of about 5%. And 5% methemoglobin, you might have a little symptoms of I'm slightly short of breath or blue hands, blue lips, but honestly, most people they hardly even recognize it. And the beauty is that dose of methylene blue, the higher dose is what was necessary for killing Bartonella. So we got two birds with a stone. The methylene blue is hitting the Bart more effectively. It's making the Dapsone easier to use. So these protocols have basically gotten easier and safer every year. I think once the randomized trial is done, we're going to see a huge shift.